All right, so I just came from a great training session with Coach Dylan over here with some animal flow. So these are things we're using in the office. I myself is also still learning and also still am showing what I know incorporating to the patients for rehabilitation. So now, since he did some good extensive training with me, I got to treat his back because his back is kind of acting up a little bit because he did a lot already today. I'm going to use my FAKTR instrument here, but we're going to do some cupping. Sorry.
It's just cold.
Sorry, it's a cold day today. I'm just using an only here just so that way the instrument and the cupping, which I've videoed and recorded before, just gives a little bit more some sliding factor if I need it, okay? So once again, cupping is borrowed from acupuncture, which is, again, we call myofascial decompression. So unlike ischemic compression or pressing down, such as using the FAKTR or Graston tool or active release technique, this is actually grabbing the muscle and fascial tissue to help break up any type of adhesive quality restrictions and get some synovial fluid within the muscle and fascial tissue together. Also promotes some blood flow. The thing is, it is going to be feeling a lot tighter on this patient. When anybody else we use it, you're going to see some big, round, dark red welts or purple welts too. Like he just got suction, because literally that is what's going to happen. All right, so let's begin. He's having some tightness in his back, so I'm going to target his erector spinae into his QL system. And here we go. We're going to go ahead and just cup one area. Again, I place an emollient just because if I need to slide the cups around, when he needs movement, that's there. And I like to use, like for me, for my own practice, I like to do about 4 on the paraspinals of his lower back. So this is what I like to do with some patients. I like activity. I like movement because that's what we're supposed to do, movement. So with Coach Dylan, I want you to go ahead. We're just going to go ahead and do from a straight line position, seated, and go ahead and bend down for me as far as you can. Feel okay?
Yep.
And then back up again. Do about 7 to 10 of these first, so he's used to it. So I added 1 plane of motion from flexion into neutral to flexion. How about we have your arms crossed?
Okay, dokie.
All right, this is kind of similar to what I do with active release technique. We're going to get into some ipsilateral rotation and extension, and then into contralateral rotation and flexion, or opposite side flexion and rotation. We're going to do about roughly 10 times on this side, and then 10 times on this side. So I'm guiding me there too. This is another good move also in terms of treating. Okay, it's just like the other side. You're going to go ahead and ipsilateral rotation extension into contralateral flexion and rotation. 10 of those, please. So I'm making him do the work. That's important. I need my patient. We need our athletes. Anybody else in terms of treatment, movement. Movement is key. All right, so we're done with the cupping. You can see the round welts. Obviously, this is all from the suction, the myofascial decompression. Sometimes I also like to do sliding with the cups. So a little bit less tension there. I'm going to instruct patient here or Dylan to go ahead from extension into flexion. So this is another mode of treatment with the cups. And once in a while, you start to lose flexion, and we add a little bit more. The purpose and the idea of this, again, is we're trying to get more synovial fluid in between the muscles and the connective tissue, thereby increasing flexibility, thereby also promoting a sense of healing in the muscles too. And then in the long run, less restriction movement for him and less pain and discomfort. You doing okay?
Yeah.
Oh yeah. All right. Whew. And this is myofascial decompression or cupping of the lower back. Okay.